Hi everyone, it's Rena Jadhav here, founder of Health Bootcamps, and here with me today is Dr. Leigh Erin Connealy, who is not only my mentor and the most inspiring doctor I've ever met, but she is what I call the cancer killer amongst us. She is on a crusade to eradicate cancer, and as an MD with an enormous amount of additional training, she is here today to tell us how we can all do it together. We no longer need to be scared of cancer and to stick our heads in sand and somehow hope that it won't happen. We are going to do something about it. But more importantly, Dr. C is coming back from a conference in Baden-Baden. Dr. C, welcome, and tell us a little bit about this conference.
Thank you, Rena. So great to see your pretty face again. Yes, so Medicine Week in Baden-Baden is very famous. It's been going on for 52 years. So doctors from all over the world go to this Baden-Baden Medicine Week to learn all kinds of medicines, all kinds of machines, all different products, all different everything. But one of the biggest things that I heard constantly is that every country now is ravaging from cancer. I met a doctor from Israel, met a doctor from Austria, obviously all the doctors from Germany that were there, but there were doctors from Italy, Thailand, all over the world, and they were talking about the ravages of cancer and the escalating rates. And one doctor came in and told me, he says, Dr. Connealy, he had come in late to a meeting, and he says, Dr. Connealy, the world is dying of cancer and chemotherapy. And because as all we have is surgery, chemotherapy, and radiation. But the World Health Organization publishes that 80 to 90% of cancers are eating and lifestyle. And what doctor entertains their patient with eating and lifestyle changes? What doctor? I have never. I live in California, and I see patients from all over the world, all over the United States, and I have never met a patient who their doctor told them that what they eat and their lifestyle matters. Not at all. In fact, they tell them oftentimes it doesn't matter. So we have a very serious schism going on in our community, and patients are misinformed and misled. And doctors, I call them, they're misdirected brilliance, because they're very smart people.
Yes.
But it's misdirected brilliance. And if they knew what I know and what I have learned, they would be doing what I am doing. And so we must let the world know and get this information out, Rena, how patients can prevent, and if they have a chronic illness, they have the information to heal.
Yes.
And we know that the cure for cancer is prevention. Mm-hmm. And like I do and I say in all my talks, it takes from one cancer cell to tumor formation, 8 to 10 years. So that means we have 8 years of opportunity to prevent cancer. Yes. Once your body has something growing 2 to 3 millimeters, remember that's a little tiny, it already has the potential to spread in the rest of the body. So I tell people eradicating a tumor does not mean absence of disease. Right. But we've got to prevent this transition in the body from year 0 to year 8. We've got to stop it in its track. And we have the algorithm, and it's not we. I, unfortunately, was born in the 50s where I was given a drug that caused cancer. So my personal passion has been how not to get cancer and how to prevent cancer in my patients. So of course I've developed the algorithm, and the algorithm that every patient should know about, every physician should know about it, because the patient needs to be empowered with information so that they can teach their doctor how to order the test that they need.
Exactly.
And today we're in the world of unbelievable communication. So this can happen very quickly, Rena. And I want the world to know, I know you do, because of your own personal history yourself, that you have been victorious over cancer.
Colon cancer at 35.
Yes, exactly. So we need to empower and educate and encourage all these patients and potential patients that maybe aren't patients now, but that they can take charge of their health, and we can self-educate and self-care and self-heal.
And kudos to you for being on this mission of making this happen. So you've created the Beat Cancer Boot Camp. So for those of you who are listening or watching, please check out Dr. C's Beat Cancer Boot Camp. Amazing reviews. It works. You will not be sorry. Check it out. With that said, why don't you share what are the core components of that algorithm? So for someone who doesn't have cancer but is frightened that they're next because maybe a loved one got diagnosed,
Right.
what are the components of that algorithm? What do they need to start focusing on as of today?
Okay, well, first of all, if you're not feeling great and you have any symptom, any small symptom, a little cough, a little pain, if your body's talking to you, then you need to say, I better go get a checkup, make sure it's not anything. I used to not say that before 10, 20 years ago, but now I ask every single patient, how did this come about? What was your first symptom? Because I learned through my patients.
Yes.
So they'll say, oh, I didn't have anything, or I went for a routine screening of a mammogram or thermography or a urinalysis or some little thing. Most of the time, patients have a symptom. Chronic fatigue, chronic neck and back pain, failing eyesight, hernias, blood clots. All those are signs of cancer, all right? But there are other signs that you can have just a little cough. If you just have a teeny little cough that doesn't go away, if you have a chronic abdominal pain, any kind of chronic pain, that's the alarm system going off in your body and saying nothing, there's something going on. If you go to the doctor and the doctor has the information to know and work up cancer. I had a friend of mine who came to my clinic just to visit. He's in Washington. He practices integrative functional medicine. He texted me, he says, Dr. Connealy, give me the algorithm. What are the blood tests? What are the things I need to do? So let's talk about that. On a routine blood test, a doctor can order a CRP, C-reactive protein, which is a marker for inflammation. If you have inflammation in your body, it's the red engine on the dashboard that's telling you something is wrong. And so inflammation is the precursor to all diseases. It may not be cancer, but it may be heart disease. It may be MS. It may be some other chronic disease.
And what range are we looking at in a C-reactive test?
Yeah, your C-reactive protein should be less than 1. So if it's 1.1, 1.2, 1.4, any slight elevation is a warning sign. Then you want to check your vitamin D. Your vitamin D influences 3,000 genes in your body. It prevents cancer, helps treat cancer. So not to mention the 100 of other functions it does. Then the doctors need to check the hemoglobin A1C. The hemoglobin A1C is an aging marker and a test to tell you if you're pre-diabetic or diabetic. We know that patients who are pre-diabetic or diabetic are very high risk for cancer. So you want to make sure people are in the ideal. What is ideal? The hemoglobin A1C should be somewhere between 4.8 and 5.2. We know that Johns Hopkins did studies that showed after 5.0, the cells already have microscopic aging facets. Wow. So the better the hemoglobin A1C, the less you're aging, and obviously the more powerful your cell is. Now, the other blood test that I like to do is the DHEA sulfate. The DHEA sulfate is a blood test. Now, all these can be done on your own. Basically, you can go to Direct Labs and order it yourself, and then partner with a doctor who understands integrative functional medicine and can have a very fast, proactive approach to treating these conditions. But the DHEA sulfate is the main hormone made by your adrenal gland. Your adrenal glands are little glands that sit like little hats on top of your kidneys. And the DHEA is the hormone of stress, immunity, and longevity. And many 25-year-olds have low adrenal gland function, Rena, because we're living in such stressful times, toxic times, bad food, and all kinds of other influences and electromagnetic. So those four, the other blood tests that I would order on a routine lab, this is just routine, any lab could do it, a quantitative HCG. A quantitative HCG is the hormone of pregnancy and malignancy. So if you're pregnant, it's not going to work. But it is the hormone of malignancy. And it is probably elevated. When I say elevated, 1, 2, 0 is normal, but 1, 2, or 3 or above will indicate there may be something going on in probably 75% of cases.
Wow.
That draw their blood. I draw it on all my patients because it's a marker for cancer, and I'm just like, well, let's just draw it. It's a simple, inexpensive test.
What
So
a
those
great
four
idea.
tests are very, very inexpensive blood tests, okay? Your insurance will cover it most of the time. Now, once you get that result, you should be fixing all of that. Vitamin D, your hemoglobin A1C with a ketogenic eating or a low carbohydrate eating program. And then the CRP with omegas and curcumin and those kinds of things. And then vitamin D, 5 or 10,000. Now, adrenals, you probably need to take DHEA with adrenal support. Why? Because the adrenal glands make over 100 hormones, so you need to support the entire gland, okay? Now, once you get that information, you got to figure out where, why, when, or how. There's a blood test. Let's say something is growing inside of you 1 to 2 millimeters. That's 2 pencil lines. You probably are already producing circulating tumor cells. Why are circulating tumor cells important? Well, that means that there's something already brewing, simmering, and fermenting. So we've got to check those because those are responsible for 95% of metastasis, and you can have them without a mass. I have many patients who come to see me for prevention. There's no mass anywhere in their body. I had a patient Monday that she convinced her doctors to order at Mayo Clinic a PET scan, but because she had all the blood tests that showed that cancer was happening in her body.
Wow.
Remember, let's remind everybody, cancer takes a long time. That means you have so much privileged opportunity to prevent cancer. And that's what we have to get out. Prevention doesn't sell, but trust me, it is way easier to prevent cancer and be happy and live your wonderful life than to be diagnosed with a dreadful, dangerous disease that once you get diagnosed, it's very easy. It's very difficult to stop that runaway train and bring it back. Now, the next thing that we do that's been around for a very long time.
Dr. C, I'm actually going to pause you before you jump because I think there's something very important you said, and I want to sort of underscore it and bold it right now and put it in all caps, which is we have to change how we think of cancer. Because we think of cancer as something that just happens and then our life is over and everyone's scared of it because of that. They're like, oh, I don't know. Do I have it? Do I not have it? I don't know what's going to happen. So I've talked to so many of my friends that are actually just afraid of it. And what we need to, according to what you've just said, is we need to change how we think of it. Cancer isn't something that just happens and that we don't have any idea that it was happening. There are symptoms, there are signs, and there are doctors who can help figure out if that sign is an indicator that the red engine light is on and there's things that you prescribe that can help get rid of it at that early stage. And I want to repeat that. There are things that you have in your clinic, because I've visited your clinic, I've gotten the testing done, and thank God there were no circulating tumor cells. But had there been, you have a whole a protocol, that then addresses it. So just because you don't have a mass that showed up on a scan, is not the end of the world. If they find a circulating tumor cell or they find—
It's not the end of the world. That's right. We have unbelievable advanced ways of taking care of that.
Exactly. So
without drugs.
Exactly. So there's an analogy is, you get a little cold or you have a pneumonia, and cancer is like pneumonia in the ICU. Whereas you knew you had signs. So if you'd known when you got the little cold, it could have been dealt with just high doses of vitamin C, as an example.
Correct.
And so
changing your mind, changing your emotional countenance, and changing your lifestyle.
So please continue. And for those of you who are listening, spread the word that cancer is not something that happens overnight, and it's not something you have to wait to get diagnosed. It's something you can take charge of on a daily basis. Please continue.
Yeah. So anyway, the blood work that can be done at any lab with your doctor, or you order it yourself. And then we do the circulating tumor cell test. And then we do the acupuncture meridian assessment. You have acupuncture points on your fingers and toes and all over your body, on your face, all over your body, that correspond like a wire to different organs in your body. And we want to know which one of those organs or glands are energetically blocked. Because we want, if they're blocked, then they're not working for you. So then I do something called the cancer cascade, which is a timeline. See if you fit in anything in the cancer cascade. Like, for example, do you need lots of pancreatic enzymes? Do you need vitamin C? Do you have viruses? Do you have immune system challenges? All these little things tell me, and it tells me how much I need to use in each thing. And then I use certain herbs that are organ systems that tell me there's an imbalance in the respiratory system, there's an imbalance in the ovary, there's an imbalance in the prostate. And then I know through this algorithm, which I've been doing for 20 years, and I'm like, how can it take this long? Now, yes, we've got the word out, but we got to get the word out to 1,000,000,001 people.
Yes, we do.
Because this is unnecessary. This human suffering and human basically impairment does not need to happen.
Exactly.
And we are not allowing, it's like, for example, Paul Allen died several weeks ago. He had Hodgkin's lymphoma. Why weren't his doctors doing these algorithms, and they would have prevented him from dying?
Isn't it shocking that even the wealthiest, the smartest are not accessing this critical information to take charge of their health? So I get very taken aback when I hear of someone passing away, or those who get diagnosed with late stage, end stage, and we all know some of those who've been diagnosed with sort of end stage cancers that are famous. And to me, we need to change healthcare system to be where what you do, what you practice on a daily basis is what every doctor needs to practice on a daily basis.
That is exactly right. If people come to see me, because my patients who come to see me just for human optimization and to be healthy, to make sure they don't have cancer and heart disease, because the third leading cause of death is doctors and medications. So I make sure every patient doesn't have heart disease and cancer right off the bat. That's the first thing. It takes a couple visits. And then we're done. And then I tell them how to live their life. And then they go execute, or they meet with the nutritionist, or they meet with the lifestyle coach or the health coach and optimize that. But they don't need my expertise for that kind of stuff. So I just I'm the big picture person to make sure there's nothing critical going on in their life, so they're not going to have any interruption.
I love it. Dr. C, you're amazing. I know we're running out of time. Any parting piece of advice, that something new that you learned in Baden-Baden? You were also part of this huge cancer conference summit. Any one new piece of information that you'd love to share that, as you know, I'm writing a book called Deceived, where you feel like we're all being deceived and you want someone to know this truth about cancer?
Right. Well, the truth about cancer for me, I have to say that I was totally impressed that our clinic is very, very cutting edge and very evolved. And even though the Germans are really, really, really smart doctors, there's things that we're doing, and I call it the American execution. You know, once people come to America, because like I had this doctor from Vienna, he listened to my lecture and he goes, "Oh my God, you Americans just know how to put it all together and execute it," which is true.
Yes.
And so, and people from Austria are brilliant, but they don't. He says, "I'm doing what you're doing, but I'm not doing it." And so that's the beauty, I think, of what we are, of who we are and what we are. We can put it all together and know how to deliver it and really teach the patient, educate the patient so that they can take care of themselves. There isn't, hyperthermia is one of the biggest treatments in the world and not used at all in the United States, which is really, really sad, because I tried to purchase the hyperthermia machine for our clinic and they will not allow it to be imported. A non-toxic, very helpful treatment for cancer. It's used literally all over the world, Japan, China. I mean, there's over 1 million PubMed articles on it, but they won't allow it, which is absolutely a catastrophe when we as Americans should be able to enjoy therapies that could totally be life-saving, not just for cancer, but for other diseases.
It's heartbreaking when I hear things like that, where we could have access to some groundbreaking technology. However, political environment and commercial desires of certain people get in the way of allowing us Americans to have access to what is clearly rightfully our right. With that said, what's wrong with the hypothermia machines here? Because it is kind of, I mean, I see it on Groupon. I see people talk about it. Are those machines not safe?
No, well, it's not the same thing. Trust me, it's not. You know, you have to have a temperature of 107 degrees under the right circumstances, proper hydration. I mean, 107 degrees is very, very, very hot. So it's not like, it's not dangerous. It's not toxic to the patient at all. I've been sending people to Germany for over 15 years to have it done. So I've never had a patient have any complication of it. So it's just that it's I don't know what kind of, I do have a hyperthermia device from France, but it's local. I'm talking about whole body.
Whole body. Mm-hmm.
The closest thing you can get to whole body would be infrared sauna, but it's not like getting your core temperature to 107 degrees.
Absolutely.
So in all over the world, they're using it and have been, and that treatment has just gotten better and better and better. So, but I believe that, unfortunately, you know, you brought about that Americans should be privileged and entitled to have the care. You're right. And it doesn't have to cost what it has to cost. We spend twice as much because we are not using these fundamental tools of self-care and self-education, of correcting people's vitamin D levels, giving them vitamin C to prevent illnesses, these very little things, getting off sugar, making lifestyle changes, getting them to sleep, getting off medications. I mean, I have 42,000 patients. Very few of my patients take medication. Okay, either I don't know how to do it, or I know how to do it and the patients are doing fine. I mean, this is ridiculous. So, and it's simple, it's inexpensive. Things don't have to cost that much. Things get expensive when you have an overwhelming diagnosis, like stage 4 cancer or some other chronic illness.
Exactly.
It doesn't have to be that way. So the U.S. ranks, unfortunately, 50th in the world, something like that, maybe even worse. Mm-hmm. And so a lot of countries are way healthier than us. And our desire can be the healthiest country in the world.
It has to be. You know, they talk about big, hairy-ass goals. That has to be our goal as a community, as a nation, that we have got to get back to being the number one when it comes to health and wellness. And you are amazing in your crusade for this. And I thank you from the bottom of my heart. For the rest of you.
Thank you for partnering with me, Rena, to do it, because we need an army to do this.
We sure do, and I'm right there, right behind you, right there. For the rest of you, please check out Beat Cancer Bootcamp. We are going to be doing a book masterclass on this amazing book, The Cancer Revolution. Ta-da! There it is.
Great, thank you.
So stay subscribed, stay updated to our alerts, and very soon you are going to be getting access to the free book masterclass with the author on the Cancer Revolution. Stay smiling. I'll see you soon.
Okay. Bye-bye, Rena.